Good evening. My name is Dr. Dmitri. How are you today? Okay. So in today's visit, we're going to work on just performing some sensory tests for you. These tests will not hurt at all. You can relax and just enjoy this visit with me, Dr. Dmitri. Now, if you would just like to speak to my assistant, he will take some notes down for you.
Thank you, Doctor. Hi, good evening. My name is Jojo. I'm currently getting my hours done for my placement here. Thank you firstly so much for coming to the test today. It's great to have you. Before we get started, as Dr. Dmitri gets all of his tools ready, I'd just like to ask you a couple questions as part of occupational health and safety requirements. If that's okay. Okay. Can I just grab your name quickly? And can I just grab your date of birth? And what's your phone number and best form of contact? Okay. What's your current address? Do you have any pre-existing medical conditions that we should be made aware of? Have you experienced any flu-like symptoms in the past 7 to 14 days? Okay, sure. And any allergies I should be made aware of quickly? Okay. Are you currently taking any prescribed medication or antibiotics at the moment? Okay, great. And could you just quickly sign this waiver so we can begin with our tests? Thanks. All right. Beautiful. I think that's everything we need. So let's begin with these tests. Doctor.
Thank you. Thank you for that. Our first test is we want to just try and work on the sense of touch. Can you feel that? Nice. Can you feel me touching just around your forehead? Perfect. All right. Can you feel that over your ears? Perfect. Okay. Can you feel that just down your neck? Perfect. And what about that? Okay. So I'm just trying to do just a visual inspection, just looking for any problems. That's it. That's it. And how have you been feeling lately? Have you noticed any senses that might be disorientated? Any problems with balance? Okay. How have your eyes been feeling? Have you been feeling any tiredness or tension in your eyes? Okay. What about taste? Can I just have a look at that tongue? Uh-huh. All right. Yeah, you always want to be careful with warm drinks. Okay. And have you had any issues with your smells? Okay. There has been a few people that have reported that their sense of smell has been not quite as good as what it used to be. Okay. So what we'll do is I'll pass you over to my assistant and he will just run a series of scent tests for you. There you go.
Thank you, Doctor. So yes, for this first quick little test, we're going to be examining your sense of smell. For this examination, I've prepared 2 solutions. One of these solutions produces nothing but clean, odorless water vapor. And the other solution will produce a scent that sort of smells like oranges. And your job is to identify which of these solutions creates the orange scent. Number 1 or number 2. Let's begin. Here is number 1. So just inhale that in. Take a moment to smell that. Okay. So that's number 1. Here is number 2. And just go ahead and breathe that in. So which one of these solutions creates the orange smell? Number 1 or number 2? Number 1 or number 2? Yeah, great. Good job. All right, let's just do one more quick test. Let me change the solution. All right, for this next one, we have, again, one of these solutions smells like water, vapor, nothing, and the other will smell like chocolate. So which one of these solutions is the chocolate smelling one? Number 1 or number 2? Here's number 1. Great. Breathe that in. And here's number 2. So which of these solutions creates that chocolate smell? Number 1 or number 2? Great. Good job. That test proved to be very successful. After you, Doctor.
Thank you. Okay, so we will continue this examination. What we're going to do now is just use the gentle sound of a tuning fork just to test your hearing. Okay, can you just point to the ear that you heard that sound? Very good. Now we'll try the other ear. Okay, again, can you just point to the ear that you heard that sound? Perfect. Now, if you could please close your eyes, just relax. We're just going to play the same tones again. Just keep your eyes closed. If you can tell me whether that was your left or right ear. Perfect. Okay, keep your eyes closed and just listen to the sound. Okay, if you can just tell me which ear that sound was from. Perfect. Okay, you can keep your eyes just closed for a little bit longer and just listen to the sound. And we just want to check that all of the ears are not blocked, all of the passages, so that the sounds can move around you. Okay, close your eyes. So the sounds are just moving from the top of your head, just over your face and over to your ears. And one more time. Did you notice any unusual sensations from those tones? You thought that they were quite relaxing. Perfect. That's exactly what we want for you to feel from those sounds. Just a sense of calm and relaxation over you. Okay, I will pass you over to my assistant while he will just continue on with the examination.
Thank you for that. For this next part of our series of tests, I'm going to be assessing your sense of sight. The first test I'm going to be performing is testing for your pupil dilation. So here I have this little pen light, and all I'd like to do is to just wave this pen light in and out of your pupil. And essentially all we are looking for is to see how your pupil in your eye responds to the presence of light. So what should be happening is your pupil dilates and then gets wider in the presence of darkness. So I'm just going to test this first eye, going in and out, in and out. And I'm just going to swap over now. Very good. Okay, 1, 2, 3, and 4. Great. For this next test, I'm going to be assessing your peripheral vision. So all I need you to do is tell me when to stop, when my fingers leave your sense of sight. Right there. Good. Great. Excellent. And for this next test, all I need you to do is follow the light. I'm going to have the pen shining right here. All you have to do is follow the light. Just follow the light. Very good. follow the light and follow the light. Great. Finally, we're just going to ask you how many fingers I'm wiggling. So, how many fingers am I wiggling? Great. How about now? How about now? Fantastic. Alright, well, it looks like your sense of sight is A-okay. I'm just going to pass it back over to the doctor to take a look at whatever else it is that he needs to run by you. Great.
Hello. So, you've been doing a great job here together. What I'd like to do is just have a general examination over your breathing and your heart rate. So, this might be just a little bit cold. Okay, just hold on a second. Okay. Okay. Perfect. If you can just breathe in and out. Breathe in and out. One more time. Breathe in and breathe out. Perfect. Okay. Breathe in. Breathe out. Breathe in. Breathe out. One more time. Breathe in and breathe out. Perfect. Just trying to give an examination just over. Okay, can you just breathe in one more time and out? In and out. Let me just listen from behind. Okay, if you can just breathe in and breathe out. Breathe in and breathe out. Okay, breathe in and breathe out. Breathe in and breathe out. Perfect. Okay, so I can hear no congestion at all within your breathing in your chest. Okay, I'll just pass you back to my assistant. Thank you very much.
Great. How are we feeling so far? Good? Well, yes, usually people will get quite nervous when they have to go and do tests like this, but really this is a non-invasive examination of your senses, and so you don't have to worry. A lot of people find these tests very relaxing, if anything. Great. Alright, so for this next test, I'm just going to be going ahead and performing a sharp and dull test. For this examination, we're essentially assessing your sense of touch. I have two different surfaces here. The end of this tuning fork is going to be considered as sharp, and the texture of this brush will be considered as dull. And all I'm going to do is I'm going to very lightly prod you with each of these objects, and you just need to tell me which is sharp and which is dull. Okay, let's begin. Dull, very good. sharp, dull, sharp, dull, sharp, dull, dull, dull. Great. Looks like your sense of touch is certainly acceptable. So fantastic stuff right there. I'll hand it back to Dr. Dmitri to let you know your results and if there is any sort of feedback we need to give you, things to work on. So yeah, thank you so much for your cooperation. Appreciate it.
Thank you. Thank you for your patience. I'd like to commend you on how calm you've stayed throughout this examination, and I appreciate this. So, as we conclude this examination, I'd like to let you know that all of your senses that we have examined seem to be performing as expected. All of your senses are working 100%, and you've got nothing you need to worry about. You are in perfect health, and your senses will continue to provide you everything you need in life to see, smell, feel, taste. Okay, I'd like to conclude this examination, and please, if you could consider myself and my assistant for your next examination, we would be more than happy to see you again. Thank you very much.